Welcome to eHealth Radio. I'm Linda DeWitt. Joining me is Kimble Richardson, a licensed mental health counselor at Community Health Network. Our topic is Alcohol Awareness Month in April. This year's theme is Help for Today, Hope for Tomorrow. The National Council on Alcoholism and Drug Dependence sponsors Alcohol Awareness Month to increase public awareness about the treatment and prevention of alcoholism. Kimble, statistics show that alcohol is the number one drug of choice for America's youth and is more likely to kill young people than all illegal drugs combined. And that's a huge problem in society. So what are we seeing in our network when we're looking at alcohol abuse among young people?
Well, an interesting fact is what we notice for adults from the time someone, this is just an average, okay, but for the time someone starts to drink until they have a dependence problem for an adult, it can take up to about 10 years to get to that point. For youth, it can just be about a year.
Really?
Right. So that's why we really want to target the youths that have that are getting into some trouble with alcohol so that we can try to address that very, very quickly.
And just as large of a population among adults that drink or have problems, or are you seeing an even split?
It's about an even split. It's a little. We are seeing a bit more youth having problems with pills and heroin, unfortunately, which 20 years ago, kids using heroin was like if they were really into the drug use, but now it's not so much so because unfortunately it's very inexpensive.
So when you're talking about alcohol, how can someone know if they have a problem? What are the warning signs?
Well, any time that it starts to affect your daily life, your work life or your studies, your home and personal life, when you're feeling like you need to drink to be calm in a social situation, and not that you want to have a drink to get relaxed, but that you need it, that you can't function in another way. If you find that you're feeling guilty or feeling bad for having drank too much, or if you find that you're drinking more than you originally thought you were going to, some of those things are warning signs. We
also hear a lot in the news about binge drinking, which I believe is 4 or more drinks at a setting. At one time?
About 4 to 5.
Okay. Mm-hmm. And so what about binge drinkers? Is a binge drinker technically an alcoholic?
It depends. And we have some different categories of what we think about for folks who drink alcohol. Sometimes we put them in a category of harmful or hazardous drinking versus dependence. So
what does that mean?
Well, it means that oftentimes people can get into accidents, like car accidents or injure themselves personally. About 40% of trauma victims have alcohol or drugs as a part of the reason they were injured. And so we really want to take a look at a lot of times if you just say the word alcoholic and what do you get as a visual image of that, a lot of times people will think, an older gentleman laying in the street or in the gutter with rotten clothes or, with a beard, unbathed, whatnot. And that's definitely not, obviously we have some folks like that, but that's definitely not the majority of folks that have problems with drinking.
Who is most likely to start drinking in their lifetime and take that first drink? What would put a person most at risk to take that first drink?
Very good question. I think most people in the United States at least try alcohol at one point in their life. Some people, because of their genetic history, can literally take one drink and be dependent on it. And they become an alcoholic from that point on. Generally, it's more of a process that you build up some tolerance. And when you don't have it, you sometimes go through withdrawal symptoms where you're physically withdrawing from it. And, having said that, it's a very dangerous drug to try to stop on your own. It's really important to have.
Some of the behaviors that a younger person may learn in college could probably put them on a path into adulthood.
Well, yes. And, I say youth between 18 and 23 really are at risk for binge drinking. And binge drinking is abusive drinking. It may not be dependent drinking. In other words, it's a binge because you're not doing it every day. So it may be that they're drinking more than 5 drinks in a setting once a week or twice a week, but it's not every day. And so you wouldn't necessarily find the physical withdrawal from that as you would someone who drinks daily.
We've also heard about a functional alcoholic. What is that?
Well, oh boy, that's a bit of a misnomer. But basically what that means is someone who can carry on their work life in general. It means someone that is able to go to work and provide some sort of support for themselves or their family, but they're not able to function well in their social life. And at some point when that crosses over to their work life, then that's when they generally know to get some help, or hopefully do.
And talking about help, what are some of the treatments and the resources that are available for those people who need help? What can they do?
There are always resources available for someone who wants to stop drinking or using drugs. And they don't have to, somebody doesn't have to have insurance or a lot of money. Okay, there are free kinds of treatment. AA and NA meetings are free and readily available all over the city, but there's also different kinds of drug and alcohol group therapies, individual therapy, and sometimes medication monitoring that can be very helpful.
Kimble Richardson is a licensed mental health counselor at Community Health Network. For more information about alcohol abuse and stress, including resources available, visit ecommunity.com/behavioral health. You're listening to eHealth Radio at Community Health Network.